Hey guys, Dr. Ben here, F8 Well Centers. Welcome. We're going to have a Q&A today, so bring your questions, bring whatever you've got, put them down below. Even if you're watching this later as a recording, put questions down below. We keep an eye on these all day long. But I'm going to get into today, the first thing I've been hearing is people have been asking me, what's going on with Halsey? She's a singer. Looked up one of her videos, 379 million views on YouTube. Pretty famous singer, 27 years old, and yet she's been diagnosed with Sjogren's, Ehlers-Danlos, autoimmune conditions. Her body is basically attacking itself, especially since having a baby. So why is that? People go, what's going on? What happened during that pregnancy that caused her to start attacking her body? So we're going to get into that today, and we're going to get into any other questions. We get all the way from why do I have an ingrown toenail all the way to how do I fix my cancer? Everything in between. Bring your questions. I'll stay on as long as you guys have them, and we're just gonna go from question to question to question there. So pop those down below, and even if you don't have a question, let me know where you're watching from. I'll give you guys a shout out. Love to see all over the country, all over the world, and tell me how things are going wherever you live. If you're outside the United States, how is the status of people's health in your area? Are we seeing people get healthier? Are we seeing people get sicker? Any of those things? Like or follow our page, but absolutely ask any questions at all. So Halsey is a famous singer. If you haven't seen her stuff, may not be your genre, and yet she is very, very popular. A lot of people, and so the thing that she's been saying lately over the last couple of days, if you just do a quick Google search, I'm looking to get to the root cause. I want to get to the why that my body is going haywire, that my body is attacking itself, and that's the really important thing that we're hearing, and I'm so glad to see it, because this is truly what happens. We see women all the time, first, second, third, fourth, however many kids, but after one of the kids, there is a dramatic decline in their health. They were never the same after that one baby. And if that happens, 9 times out of 10, that is an estrogenic event that is driving an autoimmune condition. And so the body is attacking itself, and they were never quite the same. Fortunately, during pregnancy, a lot of women, they actually feel better and their autoimmune calms down, but afterwards, it actually can get a lot worse. Hey, Helen, good to see you there in Michigan. Let me know if you have any questions. So here's what happens. We know that with conditions, this autoimmune condition. And so autoimmune can be triggered by blood sugar imbalances. It can be triggered by adrenals, stressful events, major stressful one-time things, or chronic stressors. It can be triggered by infections. Epstein-Barr is a very common one. It can be triggered by even vitamin D deficiencies. We want vitamin D upwards of 80%. It can be triggered by other estrogenic events, in even not just the ones we're dealing with in regards to pregnancy, but also I found teenage girls with autoimmune conditions driven by going into that puberty side, seeing girls go on birth control pill, going through menopause, all types of different things. So again, everybody jumping on, pop down a question, live Q&A, anything you got questions about, go ahead and bring those. You, a loved one, anybody else, ask those questions down below. Otherwise, I'll just keep rambling on about all types of different things. So, and we've had some that people have asked over the last week, so I'll jump into those if nobody has a live question as well. So Halsey, this famous singer that has been diagnosed with Sjogren's, Ehlers-Danlos, she's had endometriosis, all of these different things. It didn't say who she's working with, but when you start hearing somebody say root cause, looking to get to the underlying what is truly going on, then I start thinking, you know what, that person is probably working, or if she doesn't know about it, she needs to be working with a doctor like one of us at F8, where we're looking at that functional medicine approach, really getting to the underlying root cause is what it's all about. So what can you do for autoimmune? That's another question we get all the time. What can you do to fix that autoimmune? Well, we've got that circle, and we've got to go through each and every one of those systems, remove those triggers, and get that cranking. There we go. We got a question from Camille. What's the best way to improve kidney function? So first of all, you have to look at what is going on with the kidney. Why do we have low kidney function in the first place? And is it really just a low kidney function? Is it a full-blown disease? Is it a genetic kidney issue? Some of the basic things are going to be, obviously, drink more water. A lot of people are dehydrated, and they need to drink more water and get that hydration going into their system. Other people are it's going to be, I need to do some type of a kidney support, kidney nourishing, and that can be done. There's a great juice you can make, celery juice, cucumbers, parsley are going to be really good. So you put that all in the juicer, juice that down, and then you drink on that throughout the day. You can dilute it with extra water and just drink on that. A lot of good electrolytes, minerals. Kidneys need those good electrolytes to be able to work as well as they possibly can. So Camille, let me know specifically what is going on there. So Sharon, what causes uterine fibroids and why do they get so big? So not everybody, their uterine fibroids get so big, but some people absolutely can. A lot of the deal with uterine fibroids is ultimately a hormonal imbalance. And so you've got to look at where those hormones are out of balance. And for a lot of women, it's actually a blood sugar based issue. So remember, in women, when their blood sugar is out of balance, it's going to take those estrogens and ultimately drive that DHEA, drive that testosterone. We'll see polycystic ovarian syndrome. We'll see these uterine fibroids. A lot of different female hormonal-based fibroids and tissue like that are going to come about because, one, the body is not able to handle those blood sugar swings like it is. Number two, you're not eliminating your estrogens like you're supposed to. So I would look into liver detoxification. I would be making sure that you're not getting excess estrogens from plastics, from all types of different, you just do a quick Google search of where do you get external estrogens in the body from, and start taking a lot of those out, making sure that you're not putting those in, but also making sure that you're excreting and that you're eliminating like you need to. So both of those are going to do a lot to help decrease the chance for uterine fibroids and ultimately so another thing that we're looking at, so again, anybody pop questions down below, just put those in, type those in, and I'm going to go as long as we have questions today. So getting back to that autoimmune, we also have environmental issues. So some people, when they get into a moldy house, when they're around chemicals, I had a patient a couple of years ago, she was in full-blown liver failure, autoimmune liver. They wanted to do a liver transplant. She was 23 years old. It was triggered by working in a windmill factory here where they make those giant windmills that produce a tiny bit of electricity, definitely not enough to make it worth it for her liver to shut down. But they were using some really nasty paints that have to survive up in Wyoming and deal with the sun and the wind and snow and all these different things. And it triggered this autoimmune condition in her liver, and she was not able to overcome that, and they wanted to put her on a liver transplant list, and they actually did. We got her to the point where her liver enzymes went totally back to normal, liver came back to normal. We calmed all these triggers down, and at the last visit, the liver doctor was like, I guess we need to take you off the transplant list because you're fixed. I never got a call from that doctor. It would have been interesting to have that conversation of what did we actually do to help her get better, but we didn't get that call. Someday maybe I will. But here's the deal. You need to figure out those whys, figure out those triggers. Here's Camille again. What's the best form of electrolytes? The best and cheapest form of electrolytes you can get is what is called Celtic Sea Salt, just like the Boston Celtics basketball team. It's spelled the same way. The Celtic Sea Salt. It's made by the Grain and Salt Society, and it's from France. They bring ocean water into these clay holding pins. It naturally evaporates. They rake it up with a wooden rake, and it has over 80 different electrolytes and minerals, versus most sea salt has like 5 or 10 or 15. So it's by far the most electrolytes of any sea salt out there. It's going to be the cheapest way that you can get electrolytes. Doing a teaspoon a day or so is going to be great to get those electrolytes in the body. Put it in your water, take a pinch of it throughout the day, whatever you want to do, but get that Celtic sea salt in the body. We've used it for 20 years. It's amazing. It's what we use on all of our food and everything. You are welcome, Sharon. So some other questions we had this week were, why do I get this rock hard stomach? Why do I get this gas and bloating? So we've got some more people jumped on. Go ahead and pop any questions down below. This is a live Q&A, so anything at all that has to do with health questions, or I'll answer about anything, but anything at all that has to do with health questions, pop those down below. So why do I get this gas and bloating? It almost feels like, hard, like I got a six-pack, but it's, kind of bloated out there, look almost pregnant. What is actually going on with that abdomen and that digestion? So there's a couple different things that we see with patients. One can be food sensitivity. So when people come off of dairy, or they come off of gluten or corn or soy or eggs or whatever it is, they can have less of that digestion issue. They come off of it, we heal things up, they go back, they try that food, and it comes back, and they're like, okay, I'm not going to have that again. Hey, Carolyn, good to see you. So it can definitely be a food allergy issue. The other thing that we see is a lack of stomach acid production. So stomach acid is something that's absolutely necessary to break down multiple things: protein, calcium, and iron. So if in your blood work you have low calcium, protein, or iron, you probably are not making enough stomach acid. And so then that food's going to sit there too long. It's going to putrefy, ferment, kind of push out through there. And it is just not going to be able to move through like it needs to. So that's going to cause a lot of that hard gas, bloating. Hey there, good to see you. Ambient Tracks in Melbourne, Australia. Send us any questions that you have over there in Australia. So pop those questions down below. What can you take to make acid? So here's the deal. You're not going to take anything to make acid. You can take external acid. Just go ahead and put the link down for the stomach support from our well store. And so you can get a supplement. It's basically, think of it as an enzyme that's going to give you more stomach acid. It's going to give you betaine hydrochloride. You're going to be able to put that into your stomach, start digesting more. It's going to make your stomach more acidic, and you're going to break things down. But to actually take something to make more stomach acid, there's not really anything like that. But here's the deal. Why would somebody have low stomach acid in the first place? And that's going to be, we're talking about what can you do to take to make more stomach acid. So why is the person low stomach acid in the first place? Most of the time it's because somebody is in a chronic fight or flight. They're going to be revved up. You can either fight or flight, or you can rest and digest. You can't do both at the same time. So if you're dealing with a chronic stress, jobs and cars and kids and COVID and gas prices and presidents and whatever you want to stress about, absolutely you can stress about that. But it's going to cause you to not digest as well, because your body's like, I don't need to digest right now. I just need to survive and fight this mountain lion off. So the best thing you can do, besides taking some enzymes long-term to root cause fix it, is to calm down your brain, calm down your stress response, get into a relaxed environment. Don't drink fluids with your meals. That's going to dilute your stomach acid. Don't combine your foods improperly, proteins and starches together. Keep those separate. I've done multiple videos on that before. And then you want to eat in a relaxed environment as well. So that's definitely a good place to start. What causes kidney stones and how do you get rid of them? Grace, great question. One, like we've been talking about, more water and more electrolytes. So I would be drinking, if I have kidney stones, I would be drinking a gallon of water a day. I would be putting extra sea salt in. Here's the deal. You don't want to just drink a lot more water without adding in more electrolytes, because every time you urinate, you're flushing out more electrolytes. So you've got to replace those if you're drinking a whole lot of water. So one, you would increase that water. Yes, you could look for some of those foods that they say, don't eat, don't use, that could trigger kidney stones. You get into some kind of iffy areas because it's like, don't eat protein and some of those things which you really need to stabilize your blood sugar. So I would focus on the part of the liquids and those electrolytes. Start there. The foods, most of the time, it's not just going to trigger that. Marianne, why would you have zero appetite? A couple reasons there. One would be that your blood sugar is really high, and you've got diabetes, you've got insulin resistance, things like that, where you've got a lot of glucose in your body's like, you don't really need to eat. We've got plenty of sugar floating around in the body. We don't need any extra there. So sometimes it's that. Other times there's a digestion issue where it's just moving so slow through the digestive tract. So if you're constipated, if you're not eliminating fully every day like you should be, having a full bowel movement, that could be part of it. If your microbiome is out of balance enough and you're just kind of gassed, bloating, things like that, your body won't want to put more food in there. If you're not making enough stomach acid, just like we were talking about, then food's going to sit in the stomach, it's going to putrefy, it's not going to move through the digestive tract as well as it should, and we'll see some issues through there. So look for those, and that could definitely be helpful. Hey Hazel, how are you? What can I do for some ulcers and inflammation? Doc put me on PPIs. So again, here's the deal. Proton pump inhibitor is trying to squash your stomach acid. Here's the deal. I guarantee you, 99.9% sure if I had a farm, I would bet the farm that you don't make enough stomach acid to begin with. If we have low stomach acid, we're going to be more likely to develop or not kill off and develop H. pylori. H. pylori is actually a bacteria that causes these ulcers. And so that H. pylori, 80% of it is actually found in the small intestine, which is the duodenum. How you remember. So the duodenum is the first part of that small intestine. And so a lot of people think, oh, I just get ulcers in my stomach, and that's where H. pylori is. But really, 80% of H. pylori is actually in the small intestine. So you probably have an H. pylori infection. Even if on a test it showed negative, there's really no great H. pylori test. Look for neutrophils. You want neutrophils under 58. If they're over 58, probably going to be H. pylori. And then also look for eosinophils. You want those under 2. And if they're over 2, you probably have some leaky gut and probably that H. pylori damaging and irritating that gut lining. So if you have duodenal ulcers, you're bringing foods into your small intestine, from that small intestine into the bloodstream too early and creating this immune inflammatory reaction. So what do you have to do? Well, you've got to start with making sure that you're eating in a relaxed environment, not drinking fluids with your meals, make sure you have enough stomach acid. The PPIs, again, that doesn't even make sense. Think about this. Your small intestine does not have stomach acid. Yes, there may be some that drains into there when it opens up and foods go through, but if you have a duodenal ulcer, that has nothing to do with the stomach acid. That is that is a small intestine ulcer in there. So you've got to work on glutamine, marshmallow root, aloe vera juice, all these things to start healing up that small intestine lining. And you need to eat in a relaxed environment, make sure you're digesting well, but ultimately give your body the ability to heal in that digestive tract. So that's going to be great. And Russell, what can cause continuous diarrhea in dialysis patient with a colostomy? That is a challenging question, but ultimately it's a malabsorption issue, and you've got to start with taking a step back, pull out all the potentially allergenic foods, gluten, corn, soy, dairy, any eggs, any nightshades, nuts, seeds, beans, anything like that. Go very, very basic, and then you want to start working on some support to make sure that you are breaking foods down and digesting. You need to make sure that you're chewing your food really well. 30 to 40 chews per bite is what you need to be doing. Then you need to make sure you have enough stomach acid. You need to make sure that you're making enough bile to break down your fats. You need to make sure you have enough enzymes to make sure that you're digesting that food, so that when it does get to the part of your digestive tract that's still there, that's still able to absorb and break down and do those things, it's doing as well as possible. And then you need to look into healing that gut, and you need to look at glutamine, marshmallow root, aloe vera. You need to look into different nutrients that are going to support that small intestine lining and as much nutrients absorption as possible. So that's not a fun one, but you've got to go deep there as well. Hey there in Australia, what remedies do you have for someone with chronic sore throat? So the first thing would be to figure out, is the sore throat actually from an infection? Yeah, so is it strep throat? I've had patients that when they come in, they've had strep throat 11 times in the last 12 months. So sometimes it's a true infection going on, and you've got to support that immune system. So there's no natural gargle or things like that. If it's a chronic infection going on, you've got to correct that underlying why. Just like I always say, you can't out-supplement a weakened immune system. You can't, again, out-supplement a sore throat. So you got to figure out why that sore throat is there. Sometimes it's this chronic sinus drainage that's going down into that throat all the time. Maybe you're living in a moldy house and you've got this mold all over the house, floating around, getting into your nasal passages. You're continually creating this infection in your sinuses, and it's dripping down into your sore throat. Maybe you're sleeping with your mouth open and you're drying out your mouth and having issues through there. So first, you've got to fix the why. Find out the why that you're having those sore throats. If you know why they're there, or if you know that it's an infection, then you've got to get your body as strong as feasibly possible so that it can fight out that infection, and whatever you're going to do to deal with it, deal with it. All right. He's concerned with medications prescribed and side effects, hydroxychloroquine, excuse me, and prednisone. So here's the deal. That is an autoimmune condition. So whether it's mixed connective tissue disorder or whatever they call it, your ANA is probably high. That is an autoimmune disease. So just like we were talking about earlier with Halsey, she's got multiple autoimmune conditions. Sjogren's, that can show up as high ANA as well. Ehlers-Danlos, that's kind of a connective tissue disorder as well and has some autoimmune components to it also. You've got to get to that root cause. So again, check your blood sugar. Make sure it's 85 to 110 all day long. Stabilize those adrenals. Get out of your fight or flight. If it's a stressful marriage, if it's a stressful job, whatever it is, you've got to fix those things and get that stress calmed down as much as possible. Number one stressor to the adrenals is blood sugar swings, highs and especially lows. You've got to get your vitamin D up to 80. So check your vitamin D. Don't just take a bunch. You've got to test it and see where you're at. You've got to deal with any other infections in the body. If you have a chronic viral infection, if you've got a H. pylori bacterial infection, any of these things going on, you've got to deal with that chronic infection. You've got to deal with environmental issues, just like we were talking. If you've got mold or chemicals, anything like that, you've got to deal with those. And then you can start thinking about dealing with that that diagnosis of connective tissue issues. Sharon, seasonal allergies suffering every spring and in fall. Help. Here's the deal. You've got a bucket, and your bucket is so full, a few pollens come in from outside, and that bucket overflows. That's what seasonal allergies are. So what you have to do is you have to pull out some of these plugs in the bucket, get that bucket draining, get out a lot of these other things that are leading to that. Mucus and dairy gluten and dairy are both mucus producing foods. So even if you don't have an allergy to them, in the spring and fall, eat less of those foods. There could be food allergens. It could be leaky gut. You could have a liver issue. You could have an adrenal issue, blood sugar issue, all these things. You get your body fixed. You get your body as healthy as feasibly possible. And that's what we do at FA. When we run our blood work with patients, we get this huge picture of what's going on. And then we just get started. Boom, boom, boom. We give everybody a continuous glucose monitor. We figure out what is actually going on and then do the right treatment to get those things balanced out. But you can't be filling your bucket up so much so that all it takes is one little pollen to go over that edge. So get your body in the right place and as strong as possible. All right, Jennifer, good to see you. I had an upper GI scope recently. Biopsy said negative for H. pylori. Are you saying it could still be present in another location? Absolutely. If all they did was go into the stomach, then 80% of H. pylori is actually in the small intestine. And here's the deal: even a biopsy does not give you the be-all and end-all. It is not definitive that H. pylori is not there. There's other reasons why you can have ulcers. I'm assuming that's for an ulcer, but ultimately you've got to figure out what is going on there. And even if you don't ever truly know it's H. pylori, you're probably going to have to work on that whole gut microbiome and bad bacteria and everything anyways. And so, killing off with whether that's oil of oregano, garlic, wormwood, all types of different things, you're going to be able to kill off the bad stuff, bring in the good stuff, good bacteria, glutamine, zinc carnosine, a bunch of things that are actually going to start healing that digestive tract, healing that stomach, healing that small intestine. But yeah, 80% of H. pylori actually hides out in the small intestine. So if they didn't go to the small intestine, they just scoped your stomach, very good chance they missed it. Let me know what symptoms you're having, Jennifer. All right, Kathleen, my vitamin D blood test was 27, normal starts at 30. I think, how much D3 should I take? This is a great comment, Kathleen. So what I want you to really circle there in your comment is normal starts at 30. Normal is nothing to do with healthy. This is what we talk about all the time. It's the bell curve, right? You've got a bell curve, just like in statistics. Ranges in there that if it's outside 30, outside 108, then you've got a vitamin D problem. But if you're inside 30 to 108, you're fine. But here's the deal: 60 to 80 is optimal. So, and if you've got an autoimmune condition, you need to be closer to 80. So 27, even if you were 31, 33, 37, whatever it is, you are low, and you're significantly low in vitamin D. We know that optimal vitamin D, less likely to get COVID, less likely to go to the hospital, less likely to die. We know with optimal vitamin D, your brain's going to work way better, and you're going to have less depression, less mood issues, things like that. So vitamin D at 27, absolutely low. For most of our patients, we would start in the 10,000 a day range on that. If you do that, you want to make sure that you're checking in about 3 months, just to make sure it's not going up too high. But most people, that's what it takes to get even into that 60 to 80 range. So 27 is very low. 30 is very low. Even though the lab says it's okay, that's how we look at all of our blood work in FH, is we're not just looking at this, oh, what's the average person that's not gonna die if they're in that range, but what is the optimal person that's gonna live their best life yet? So, let's go here. Kelly, good to see you. Recently got tested for anemia. My symptoms fit, but my doc says no anemia. My friend who's a functional nutritionist looked at my labs and says definitely anemic, ferritin is 17 and iron is 27. Is my doctor wrong? Here's the deal. Again, they're looking at this at the wrong range. How about that? So is your doctor wrong? I'm not going to tell you your doctor is wrong. I'm not going to call them out and tell them that they're practicing bad medicine or anything like that. But I'm going to tell you he's looking at the wrong range. He or she is looking at the wrong range, and that ferritin for women needs to be 40 to 125. And even 40 is a little bit at the low end. So 17, if you're in the teens on ferritin, ferritin is your stored iron. I always say if there's only one blood work marker I can test on everybody, it would be ferritin. Ferritin too high, we actually see way more high ferritin, is going to be inflammation, liver issues, blood sugar, insulin resistance, all these different things. Too low is going to be that anemia. And so this is an iron anemia. Your doc says it's not anemic. Well, too bad. It is anemia. Iron, just straight up iron at 27, you should be like 60 or 80 on that. So absolutely, you do not have enough iron, almost guaranteed, depending on where you live. Your hemoglobin is low, probably 11 or less. Your red blood cells is probably on the low side. Your hematocrit, your HCT is going to be a little bit low as well, and you're going to be tired. Your brain needs two things. It needs oxygen and it needs glucose. So that's why it's so important to keep that blood sugar 85 to 110, but it's also really important to keep that ferritin, because ferritin, that iron, is going to help transport oxygen around the body. So if you don't have enough iron, you don't have enough ferritin, there's no way you're going to be getting oxygen to your tissues like you need. So absolutely 100%. But here's the deal, Kelly. You need to take iron, but you have to figure out why. Why are you anemic in the first place? Are you not eating enough iron-containing foods? Are you not absorbing your iron like you need to? Do you have a damaged gut lining and you're actually losing blood? Are you having menstrual cycles that last for 3 weeks? You've got to figure out the why, because just taking iron is not going to fix it. You stop taking iron, you're going to go right back to being anemic. So you've got to figure out the why and then start moving your feet. Hey, Jennifer, fat malabsorption. So, that's obviously you start by looking at the gallbladder. You start looking at, do you have a gallbladder? Is your liver making enough bile? And then is your gallbladder storing it? Do you have sludge in your gallbladder? Are you squeezing it out? That bile that the liver makes is what helps break down fat. And so if you're not squeezing out enough bile for whatever reason, then you're not going to be breaking down your fat. That's where you come in with bile salts. That's where you come in with different nutrients that are going to be helpful to actually break down that fat. So I'm not sure why they would do an upper GI on that. That doesn't make a lot of sense. Kathleen, also, can vitamin D level 27 cause me to be tired all the time? Thank you so much. I'm going to say no on vitamin D of 27. That in and of itself is not going to make you tired all the time. But what is going to make you is your blood sugar is bouncing all over the place. If you have leaky gut, if you've got inflammation, if you've got insulin resistance, if you've got fatty liver, all of these other things, those absolutely can make you tired. If your thyroid's off, if you got Hashimoto's, all these things. So vitamin D will not make you tired all the time, but I guarantee you, if you're tired all the time, there are other systems out of your body, and that's what we do. If you need blood work and you haven't been able to get the answers, we can drop ship that to you anywhere in this country, Canada, anywhere around the world. We can get you blood work, and we'll be able to see all these answers to the questions that we have. So let us know, Kathleen, if you're not getting the support that you need. We can work with you anywhere in the country. Hazel, what is low urea levels in a 16-year-old? His is 2.7, but supposed to be 3.2. Is it dangerous? And what can we do? I would need to see the rest of the blood work. If that's the only thing that's out of balance, I wouldn't be that worried about it. And if there's no symptoms, but if there's a lot of other symptoms and there's other systems out of balance, then it's probably going to be secondary to some of those other things. But low urea just by itself. Jennifer, colonoscopy done as well. She had her upper GI, so they went top and bottom and met in the middle. Awesome. So, you've seen a lot of what's going on. But here's the deal, Jennifer. I bet you didn't even get the answers that you need. So if you're not getting the support that you need and you want to dig deeper, we've got F8 docs waiting to work with you, and we can drop ship blood work. We can really figure this out. Gut things is our specialty. We can get that dialed in very, very quickly. Let's go here. Hey Pam, Montrose, Colorado. That's for those of you who don't know Colorado. That's over on the western side. Just had your blood test. Excited to see the results. Thanks for being so knowledgeable. Awesome, Pam. Excited to see what all of that shows. Yeah, it's an in-depth, thorough blood work. We're looking at all of the thyroid hormones, Hashimoto's markers, female, male hormones, testosterone, estrogen, all of those, adrenal hormones. Looking for autoimmune markers, looking for inflammatory markers, going to be seeing for infections, all types of different things. You've got to throw the net out wide, and then you narrow it down into what that optimal range is going to be. So I guarantee you, Pam, you move your feet, you do what you need to do, we find stuff on the blood work, and you're going to feel better. It's just how it goes. You're welcome, Kelly. And yep, any other questions, put those down below. Thank you, Dr. I learned so much from you. How do I know if you accept my insurance? So shoot us a direct message, Kathleen or Jess will shoot you a message, and we can talk to you all about how we go about working with people. So again, if we don't have any other questions, I'll jump off, but if you guys do, put those down below, even if you're watching later. So thanks guys so much for being on. I love these Thursdays. I look forward to them. Bring your questions, tell your friends, share this information, whatever you have going on. Let's get started. Let's move our feet. Let's, just like Halsey, looking for that root cause of why she now has 5 autoimmune conditions and why her body is going haywire after having a baby. She's got to get to that root cause. I hope she finds somebody like F8 to work with, because if she just goes on prednisone, goes on methotrexate, goes on Humira, hydroxychloroquine, any of these different ones, she's not going to get the solutions, not going to get the answers. So I encourage you to keep digging deep. Let us know what questions you have. If you have not been on our email list, send us a DM with that, or put that down below. We've been sending emails out Tuesday and Thursday if you're not getting those. And we have your email. Check your junk email box as well. It can be in there. So love having you guys on. And if you've got any questions at all, even throughout the week, send us a DM and we will get that going. Mary Kay, hi, so glad I found you. Can we do testing by virtual appointment? Absolutely, Mary Kay. We can drop ship that blood work to you. You get the kit in the mail, you take it to a local lab or have a phlebotomist come to your house, draw that, and then it gets shipped off, and we get it back in a week, and one of our FA docs will work directly with you and tell you exactly what's going on. If we think we can help, great. Otherwise, we'll give you the information and tell you where to go. But most people that come in for that process, we're able to come up with a game plan and get them their health back, and then just move our feet step. So yeah, Mary Kay, just reach out and we can talk to you in more detail on that. So if any of you guys are having health issues that you cannot get figured out, send us a message. We can do a complimentary consultation with one of the doctors, whatever it is that you need to do to get some answers, to get some motivation back. So many people are depleted, down, depressed, beat down, just not able to get the answers. So I'd love to give you guys that support that you need. Make it a great day.